What we have seen in terms of progress is I think there have been some improvements in terms of equality and opportunity. I think this is based on our experience of working across health and social care. In some parts of London, they are trying to address language issues, trying to address, understand, culture needs, and also addressing maybe, religion or faith, people's faith and beliefs. I think there are a couple of practices that actually have open to have women-only clinics. We've seen some group practices also that have people speak different languages there. So I think some kind of progress has been made, but there's still quite a lot that needs to be done around equality and opportunity. The other areas where we've seen quite good, progression is around the consultation. That people being able to, voice their concerns at the patient, user groups, and also through the links. I think those are quite good avenues for people to raise concerns and try as much as possible to influence the shaping of health services that would benefit or suit their needs. This is from our organisation's work with the client group. We've seen quite a number of people coming in from the Francophone communities. There's been an increase, and there are difficulties when they go to the hospitals for their eye test, in them trying to explain the level or the degree of their eye condition. So we've had to act as escorts on their behalf to go with them, with someone who can actually speak French, or it could be Somali, to help them explain to the ophthalmologist the level of vision they have. So we've seen in that particular area that there is still a bit more work to be done there with the different hospitals. English, or maybe limited English, because when you talk about ESOL, you find out that places where they teach ESOL, they teach them ESOL to be able to go to the market or get on the bus or ask a question. But the ESOL doesn't include when it comes to medical needs or medical conditions where people find difficulty in actually explaining their situation. And when they go to the frontline desk or the receptionist, it's quite difficult for them to actually understand what the patient or our clients are trying to say. So I think quite a lot of work needs to be done in that area. We would love that to be addressed, in next year. I think there needs to be much more closer work with the voluntary and community sector, because we are actually much more closer, nearer to the grassroots. So we can actually inform, the decision makers or statutory officers on how to actually implement or maybe to deliver, services, and in a way could actually cut costs. So where a client goes in and says that we've had a case of a client whose vision was actually very poor and was deteriorating, but because she couldn't actually speak English and couldn't explain to the person who was doing the eye test level of vision, you understand, you find it difficult, and you find that has additional knock-on effect on other services, you understand, and you find that client now has lost their sight. So it's more burden on the health and social care and statutory services.